You're listening to a Raconteur Studios podcast.
Hello and welcome to the After Hours Skin Clinic. I'm consultant dermatologist Dr. Emma Craythorne. The clinic is closed, the scrubs are off, and I've got Dr. Ellie Rashid here with me. And in this episode, we're going to be diving into a skincare question from a listener. And this is actually also something, I get asked questions about polynucleotides all the time from patients, but also outside of the clinic. So I'm glad we're here to talk about this. Welcome back, Ellie.
Lovely to be back.
So first of all, let's look at Larissa's question. She's really curious about salmon sperm. What is it Ollie calls it?
My husband calls it salmon jizz.
So she's curious about salmon jizz, polynucleotide treatments. She wants to know, what are they? How do they work? Do they restore volume? And is this another crazy thing that people are doing where you're injecting salmon sperm into your face? Now, let's be quite clear before we get into this subject. This is not actually true salmon sperm. This is the nickname that this has been given. These are actually called polynucleotides. Dr. Ellie Rashid's PhD, yes, she's a double doctor, is actually in regenerative medicine, so regenerative dermatology. So no better to ask all the questions to. So tell us about polynucleotides, Ellie.
So, it really is salmon sperm, but is
without the spermy bit.
Origin of the product. So the origin of the product is actually derived from salmon or trout from sperm. So it's these long chains of nucleotides. So these are the building blocks of DNA and RNA. And because fish nucleotides closely resemble human DNA and nucleotides, the whole purpose of it is that you take this salmon or trout sperm, you take these long chains of nucleotides, it's very highly purified, and then that can be injected into the skin. And the whole purpose of it is that you can regenerate new collagen, new elastin, and really build a scaffold in the skin for these regenerative processes.
So what exactly is a polynucleotide? So I remember working years ago whenever these were called PDRNs, and PDRNs are short for polydeoxyribonucleotide, and that had some level of evidence for wound healing. And I think about 20 years ago, maybe we injected these into leg ulcers of diabetics to see whether it would help with wound healing. And the consensus was that there was some benefit from it. But then going on to this, we then have polynucleotides. So this is a chain of nucleotides and it's going into the skin and doing what?
So it goes into the skin and essentially it's providing the code for the generation of new collagen and new elastin. So essentially your skin cells could use this code to then create proteins in the skin. So that's how it works.
So if you've got a gene and that gene is responsible for making collagen, presumably by flooding the area full of these nucleotides, then when the ribosomes are creating the protein, in this case the collagen, it's then got a whole lot of these free nucleotides roaming around that can actually be used to make the new chain of collagen.
Exactly. So it's essentially just providing more of a blueprint for more of these genes to be creating more collagen.
Okay, so when we think about how polynucleotides work, they stimulate the skin's own regenerative processes. So this is different to a filler. It's not adding volume like a filler can, but it's thought of really as something that's biostimulatory. In other words, it's a biological treatment that's stimulating your own body's processes. And it works in a number of different ways. So one of the thoughts of how this works is by direct activation of those fibroblasts. Now, if you remember, fibroblasts are cells that are responsible for making the collagen and the elastin within our dermis, so that middle part of our skin. That is the bit that starts to get thinner over time and really is the bit that's responsible for why we get wrinkling as we get older. And so if you're able to then continue to stimulate that collagen and elastin and hyaluronic acid, then that dermis can stay thicker and it's got more bounce to it. So that's one element of how it's thought to work. Another element of these polynucleotides are that the kind of shape of them means that they do attract a little bit of water. And so it's thought that that effect can also be helpful for areas where the skin might be a little bit thin. Another way in which it's thought to work is as an antioxidant. So they scavenge up these free radicals. In the vitamin C episode, we talk a lot about what free radicals are, but essentially they are molecules that are unstable. And because they're unstable and trying to become stable, they make other molecules unstable. And that has a damaging effect to the skin. So polynucleotides act essentially like an antioxidant, really, and they scavenge up these free radicals and stop that oxidative stress within the skin. And then another element is that they do provide the raw material for DNA and RNA synthesis. So if your body's cells are trying to make more collagen, you've essentially injected a whole lot of the groceries needed for the cells to make that recipe of collagen. So it really supports that skin cell turnover. Another thing that it can do is it's thought that it modulates how the immune cell activity is, and it can dampen down a lot of pro-inflammatory responses. So where the skin might have a tendency to become inflamed in one area, there is a thought that these can dampen down that immune response. So there is a lot of science thought behind how these polynucleotides are working within the skin, but it's whether the evidence really backs that up and shows that in clinical studies. So, Ellie, that is the scientific explanation of what these polynucleotides are. Can we get down to actual clinical evidence? What studies have come out over the years showing where we might use these and what the actual evidence is?
Yeah, so there are a few studies. All of the studies are in a limited number of patients. And we need to remember that polynucleotides are a registered medical device, so they wouldn't necessarily need to undergo the same randomized double-blinded clinical trials that a drug would have to undergo.
And I'll just interrupt you there because actually some of them aren't even registered as a device. Some of them don't even have that marking, so you can buy them
without
that. So I do think there has to be an element of kind of caution about understanding which polynucleotide you're injecting into somebody or you're having injected into yourself. What is the name of the company and does it have this medical device? Yeah, because some of them don't even have that.
Yeah, so there's a few studies. So there's a study in 2024 by Sharma et al. So this was in 25 patients injecting polynucleotides into the face. So these are these quite superficial little blebs into the entire face in patients that had sun damage, so photo-aged individuals. And things that they monitored were hydration, elasticity, and pigmentation over a 12-week treatment course. And the things that were statistically significant was the improvement in skin tone and hydration. But some of the downsides of the study were it's in quite a limited number of patients, and also their skin types were white skin, so skin types Fitzpatrick skin types 1 to 3, so they didn't include patients with melanin-rich skin.
Because these are all pretty small studies, aren't they?
Yeah, so they're all, to be honest, small studies. So another study done in 2023, so this is in 30 patients, and this was a series of 3 polynucleotide injections over 2 months. So every approximately 3 weeks, 3 injection courses over that 2-month period. And they looked at skin hydration and elasticity and used different devices to measure that. And again, there was a marked improvement in hydration and elasticity with a visible reduction in fine lines. The limitations of this study was there was no placebo group and the follow-up was only limited to 6 months. So you couldn't see the longevity of how long these results last for.
6 months actually isn't bad for one of these studies. Normally they're like 12 weeks.
Yeah, and done.
Next day looks great.
With a bit more moisturiser on.
That'll be the injection points.
So polynucleotides have been used in aesthetics since 2005. And since the 80s, PDRN has been applied in medicine. And there have been more than 90 clinical trials and 34 randomised trials. But when we think about polynucleotides, they are considered a medical device. So the number of clinical studies and the evidence base for using polynucleotides is far more limited compared to PDRN.
So can we think about the right kind of patient that this would be suitable for? And I suppose, quite importantly, who it's not suitable for?
Yeah, so people it wouldn't be suitable for would be those that are pregnant or those that are breastfeeding. People wonder if you have a fish allergy, whether it's not suitable for you, but actually it doesn't contain the fish protein, so it's very unlikely to cause any issue at all. However, on all the packaging, there is a word of caution to say that if you have a severe anaphylactic type of allergy to fish, that you must exercise caution with polynucleotides. But actually, it doesn't contain the fish protein, so it's probably absolutely fine. Another group of people that I think this is really good for is those where they've got that sort of hollow, real dark under eye circles. And because you can't really inject those areas easily with Botox and also filler, like tear trough filler, I just think often gives people a little bit of swelling and often the cosmetic result isn't as good as one would hope, then I think polynucleotides can be a really lovely treatment to help to improve that under eye area, and is exactly where I have mine done.
And where I have mine done. Courtesy of Dr. Ellie Rashid.
And the neck is another really good area. So that crepiness that people can get of their neck, and it sort of really gives away signs of aging, then it can be a great area to inject polynucleotides. Again, a difficult area to improve. So polynucleotides can work really well.
Yeah, I mean, I think that's right. I think it can be really useful for this periocular area that nothing is particularly ideal for. We know tretinoin's great in this area. We know little bits of botulinum toxin can be good for those fine lines, but it's the crepier fine lines that fall right underneath the eyes can be a bit of a problem. And we know that placing filler in this area can be associated with problems in terms of lymphatic drainage or just seeing the filler in that area. And then most of the studies are really looking at people who have photo-damaged skin. In other words, skin that has had too much ultraviolet radiation and then the changes as a consequence of that. There's different ways of injecting this. And I will usually have a patient numb before I do it. So they will come and they'll have a local anaesthetic applied to the face for about half an hour before I would do the treatment, because it usually requires multiple, and I mean multiple injections. And they're very tiny injections that just go about a millimetre, not even under the surface of the skin, and create a little bleb. And it looks almost a little bit like the sting you might get from a nettle rash or something, doesn't it? Like a tiny little bleb. And you would do a lot of these in a grid pattern in the area that you've decided to treat, whether that's the neck or the eye area or wherever it happens to be. So that is the intradermal needle injection. And that results in lots of these tiny little blebs that stay usually on the skin for around about a day in some people, sometimes even 2 days it can be on the neck where the skin's moving less. And it can sometimes then merge the little blebs together and cause a bit of swelling. So there is a little bit of downtime associated with it. It's not like if you have a botulinum toxin injections and you go in and have the injection and leave and people usually don't think anything's been done. If you have polynucleotide injections, you look like you've had something done. Quite frankly, you look like you've had some body modification done.
I think it looks amazing. I actually love it. So I had mine done around my eyes and underneath my eyes, courtesy of Dr. Emma Craythorne, and went to a barbecue at a friend's house straight after and just explained what I'd had done, obviously about 3 billion questions later.
Hence this episode.
Yeah, everyone wanted it after that. But it does definitely hurt. So it's a bit stingy when the injection's going into the skin, and that numbing cream is pretty essential, and it definitely does need to go on for a good half an hour beforehand. Otherwise, I don't think people would be able to tolerate it. And in addition to the bleb technique, which is the preferred technique and what the label says should be the method of delivery of polynucleotides.
If I can just interrupt, you're doing lots of little injections into the skin, so that might be why the skin looks so good.
Yeah,
nothing
gorgeous.
to do with the polynucleotides.
Stimulatory benefit. But you can use a cannula, so creating a little entry point on the surface of the skin, and then with a blunt tube, essentially, as cannula, is to go into the skin and to inject the polynucleotides in that way. The benefit of that is, of course, you're not doing repeated injections into the skin. It's usually just one entry point, and then you can just do it in 3 different directions to cover the whole of the cheek. And some patients would prefer that. I've got a patient that I'm doing polynucleotides on who has lichen planus pigmentosa, which is a really difficult pigmentary problem to manage. And the reason why polynucleotides have been working so well is because texturally it's really improved her skin. So actually the camouflage that she uses doesn't sit within sort of her very porous skin. So it looks a lot more smooth, and the application of her cosmetic camouflage is much better.
That's interesting. Is it in her scalp, in her hairline?
No, so it's on the forehead, around the eyebrows. Yeah, nothing else has worked. But this is a good way that she can continue to use cosmetic camouflage.
Yeah, very good. And is this an expensive treatment for people to have done?
Yeah, so it is fairly expensive because you have an induction treatment. So this is often 3 injections, 2 to 4 weeks apart. And then after that, you would have injections every 3 to 6 months thereafter. And with most private procedures, there's usually a fee that you would pay the doctor directly. And then there's also what's called the facility fee. So what the hospital or the private clinic will charge that normally incorporates the cost of the product into it as well. So you're looking on average between upwards of sort of £500 up to maybe about £1,500 for one session of this treatment.
Because this field of polynucleotides, particularly in the world of regenerative dermatology, is pretty new-ish, and there's lots and lots of brands on the market, which ones do you like?
Yeah, so the Plinest brand just has polynucleotides, and Nuest has polynucleotides and hyaluronic acid. And when I'm first injecting a patient with polynucleotides, I often will start with the Nuest because that has a hydrating benefit, and actually the hyaluronic acid works pretty much immediately, so you get that instant glow, because as we know, polynucleotides take a little while to exert their benefit onto the skin. So whilst you're sort of waiting for that to kick in, that normally comes after you've had your second lot of injections or even your third lot of injections. So whilst you're sort of waiting for that benefit, it's quite nice to have the benefit of the hyaluronic acid. So the first set of injections, Nuest, and then often for the second and third, I will use the Plinest, so just polynucleotides on their own.
Okay, so should we move on to the second part of this question, which is looking at PRP, which is platelet-rich plasma, and PRF, which is platelet-rich fibrin. Shall we have a chat about what those are within this field of regenerative dermatology? What's the difference?
So essentially, it's a procedure where you take a patient's own blood, you put it through a centrifuge, so you spin it. And for PRP, you spin it at quite a high velocity. And then you get this sort of liquidy gold liquid, which is the PRP proportion, that is then taken up in an injection in a syringe, and then it's injected into the area that you want to treat. And PRF, because it's centrifuged at a slower velocity, it produces this gel sort of fibrin matrix that again can be drawn up and then injected into the area that you want to treat and manage.
So one element of this is essentially a whole lot of platelets. And platelets are little cells that are within our blood system, and they're typically responsible for creating clots. That's what we normally think of a platelet's job as doing. So why do we want to inject something like that back into our own skin?
The reason why we'd want to inject platelets into our own skin is because platelets contain these growth factors. So it contains platelet-derived growth factor, transforming growth factor beta or TGF-beta, vascular endothelial growth factor or VEGF, and these stimulate collagen production. It's also important for something called angiogenesis, which is the formation of new blood vessels. It also helps with cell turnover and wound healing. So it's used commonly for skin rejuvenation, can be used for things like acne scarring, hair loss, and in some cases post-laser recovery.
So platelets release growth factors, and those growth factors then stimulate things like making more collagen, stimulating new blood vessels, and improving wound healing. That's what a growth factor is. It's producing all of these other elements. So that's why we want to inject the platelets in. Why do we want to inject fibrin in?
So fibrin is an insoluble protein, and it forms a fibrous mesh during the blood clotting process. So in the context of PRF, fibrin acts as this natural scaffold that holds the platelets and the white blood cells together. So it allows this really gradual, controlled release of these factors that can help enhance tissue regeneration over time. And so in layman's terms, essentially, if you're injecting PRP, you're injecting this high concentration of platelets that stimulates all these pathways for improving your collagen, improving your tissue repair. And if you're injecting PRF, you're essentially injecting a matrix which allows for the slow release of these growth factors that can stimulate this tissue repair and wound healing and improvement in collagen.
So we think of the PRF being almost like a bit more of a sophisticated version of PRP. And PRP's been around for a long time. That's, it's used for wound healing in lots of regards. But PRP was what the vampire facial essentially was, isn't that right?
Made famous by Kimmy K.
I suppose with PRF, then it's going to be more sustained, longer acting. You don't have to have any anticoagulants within it. It would be more natural.
Yeah, so when you're creating PRP, you're taking patients' blood and it's spinning at a really high velocity and you're getting this liquid gold solution. But the reason why it's in a liquid form is because there are these anticoagulants, or if you like, these ingredients that prevent clotting. And in PRF, you don't have those anticoagulants, so there are no ingredients within the procedure process to clot. And so that's why you get like this fibrin matrix gel sort of solution, because some clotting will be taking place.
And so if you have PRP, or if you have PRF, how do you get that into the skin? What is the best way to get it into the skin? I know for acne scarring, we would use a CO2 laser and we would drill little holes in the skin and you can drop the PRP in and essentially massage it in, which is what happened with the vampire facials back in the day, where it was microneedling and then the PRP was put in over the top. Presumably with the PRF, you have to inject it back in.
Yeah, you do. So with PRP for hair loss, you would normally inject it into the scalp, and for PRF, you inject it in.
Let's talk about the evidence of these, because although we use them for acne scarring, the evidence for, unless it's changed from a few years ago, whenever I looked into this, I'm going to say, but there isn't really much good evidence to come out supporting their use for things like acne scarring, unless you're doing it in combination with something like microneedling or in combination with carbon dioxide laser treatment. What is the evidence like overall for supporting use of these treatments for things like hair restoration or rejuvenation in clinicals?
Yeah, so the evidence for PRP use in facial rejuvenation. So there was a large systematic review published in Plastic and Reconstructive Surgery Journal in 2023. And the issue is that in 11 of the 12 studies that were identified, there were 3 randomized split face trials. So this is where you take one half of the face and you do PRP injections, and then the other side of the face you may leave untreated or use an alternative therapy to look at whether one side of the face shows an improvement compared to the other. But the issue is that there are always such significant differences in study design, and the outcome measures are so variable, and many of those outcome measures are subjective, so it's more about what the clinician or the patient felt or thought about that treatment modality, rather than looking at objective measurements to then decide whether that treatment is clinically efficacious or not.
In other words, they asked the patient, do you think that you got better? And the patient said yes. Or they asked the doctor who was injecting it, do you think the patient got better? And they said yes.
Yeah.
And that was the level of trying to work out whether the treatment worked or not, which is really difficult because, even if you're the best will in the world being the doctor, it is difficult to remember exactly what the patient's skin looked like at the beginning. And it's difficult to compare that to photographs because a 2D on a 3D person, they're very different in terms of lighting. But also, I think the most important thing really is that the patient feels that there is a difference, because even if there isn't a difference, if the patient feels there's a difference, well, that in itself is beneficial. So, I mean, in truth, if we're looking hard and fast at the clinical evidence for these and we're trying to think as a scientist, the evidence really is not there to say that these treatments are going to be beneficial. That is not to say that they're not beneficial. And we can look at the series of patients that are presented in evidence, but in truth, they're not very well conducted large studies that can allow us to say with confidence, these treatments are making a difference in this particular situation. So they might help. But will they cause any harm?
Yes, there are a few patients where you wouldn't consider using PRP. So this is if someone has a low level of platelets. So remember, we're taking a patient's own blood and we're taking their platelets. So if they already have a low platelet count, then that wouldn't be. And some people just genetically have a very low platelet count, so they wouldn't be suitable for PRP. If you had any sort of acute or chronic infection or you were septic, you wouldn't have it. Patients that have chronic liver disease. So patients with chronic liver disease tend to have issues with clotting their blood and often have abnormalities of the platelets. And so they wouldn't be suitable for PRP. And then if you're on any anticoagulation therapy, so these are any blood thinning tablets or injections, again, you wouldn't be suitable for PRP injections.
So the list is not that extensive. You wouldn't do it in somebody presumably who was pregnant, but the list is not that extensive of who you would or would not necessarily treat. But can you get harm from PRP?
So it's an immunologically neutral substance. So there's no danger of allergy or hypersensitivity or a foreign body reaction. But you could potentially have nerve trauma depending on where you're injecting. So that's a potential risk. And I wouldn't inject PRP into someone that was pregnant or breastfeeding.
Yeah, so I think that in terms of actual harm, you know, there's obviously an injection site reaction that might happen, but that can happen anywhere with any injection at any point in time. But there's no other real risk of harm that can occur as a consequence of these. There are, however, reported cases of infection in establishments where it's not being carried out in the correct manner in terms of infectious control risk. HIV has been passed from patient to patient as a consequence of PRP in the past. So it's also a very practitioner and clinic dependent outcomes in terms of what, you know, you might end up getting. So I think that that's something to consider. So in overall, we can understand what the science is behind this and we can see why this might be of benefit. But the evidence to support its use, we certainly wouldn't think of as very high level of evidence. But the risk of harm is pretty low, particularly if you're getting this done by a recognised practitioner in a very recognised, clean, safe, infectious controlled clinic. That would be a fair roundup of those procedures, do you think?
Yeah, definitely. Really fair roundup. And also we just need to make sure that patients are having these procedures in a clinic that they would consider to be safe, and they would do their due diligence to make sure that things are conducted properly and safely.
That's a wrap on today's episode. So thank you, Larissa, for inspiring this episode on the things that we do with regenerative dermatology. If you've got a question, please send it our way. We want to know what you're interested in, and details for how to get in touch are in the show notes. And don't forget to follow or subscribe to the show wherever you're listening so you don't miss another episode. Ellie, thank you for joining me.
Thank you so much for having me.
And thank you for listening. Look after yourself, look after your skin, and don't forget your SPF. And we'll see you next time on the After Hours Skin Clinic. As always, this podcast is for informational purposes only and is not a substitute for medical advice. Please consult your healthcare professional before making a change to your treatment.